Hello, I'm Dr. Paul Wakim. Welcome to my podcast on orthopedic AME evaluations. I am a board-certified orthopedic surgeon with nearly 50 years of experience and over 5,000 AME/QME evaluations. I personally like to resolve disputes, and in this case, we resolve medical disputes instead of starting new ones. I deliver most of my reports within 7 days or less if you have the records available at the time of my evaluation. Also, about 5% or less of my reports need to have additional depositions. That means they are accurate, they're unbiased, as well as expedient reports. I would like to share with you my experience as well as my best practice policies in doing AMEs in orthopedic surgery. To resolve the disputes that occur on medical issues in the work comp system, there is many ways that can be done to resolve that issue. The state of California legislative body has developed a statute that mandates what is called the QME and AME. The labor code has emphasized that the agreed medical examiner should be the first effort at resolving the dispute. And if they cannot agree, the parties cannot agree on a AME or agreed medical examiner, then they can go to a list from the state of California called the QME list. With that, they can choose one of 3 doctors they provide them on that list. Now, another way they can resolve the disputes, if the parties, both sides, the defense and the applicant, would agree to a treating physician's report. The difficulty with that is that treating physicians are not really well educated on how to do a report, how to do an accurate impairment rating, how to do accurate apportionment, how to do proper or accurate future medical, or even voc rehab. Voc rehab is almost out of the question now because it's set in standard and depends on the degree of impairment. There comes a time when there is a dispute over an injured worker that has been gone out of work for a period of time. There is insurance companies paying for his unemployment, paying for his care and treatment, and the employment may take 2 years or over. The unemployment, pardon me, may take 2 years or over. They want to resolve this dispute, take care of the injured worker. So we come down to what's the most accurate and knowledgeable way to do that. And the best way, in my opinion, is to have really initial attempt at getting what is called an agreed medical examiner. An agreed medical examiner in orthopedics, as in my case, is the most knowledgeable person and the most experienced person to resolve a dispute. He knows of the injuries, he's seen enough of them, he's a well-known entity. And the other part is that he's normally expedient. That means he knows that they need to resolve the dispute so as to stop the hemorrhage on the insurance company. So he gets the report done in an expedient amount of time. More important to the insurance company and the injured worker and the applicant physician is to know that they're going to get an accurate report. I really haven't seen even an applicant person ask me, please wash out this patient. Wash out means don't give him any impairment. Or I haven't seen any insurance company tell me zero out patient or give him extra amount of money or whatever it is. Everybody wants accurate representation. With an accurate representation, you give the benefit of the doubt to the history you're getting from the injured worker. Injured worker gives you the history of the injury, why he's been gone for so long from work. Also, he would tell you if he can go back to work or not. Then you depend on your X-ray findings to see if something has happened before. After that, you depend on the records that are provided. Sometimes injured patients may forget that they had prior injury to the same area. The records may help us in determining, is this an aggravation of a prior injury, which means that the patient has had at least 1% increase in the injury, or is this an exacerbation? Exacerbation means just lighting up and nothing has changed from prior injuries. If it's an aggravation, the insurance company will pick it up and they will take care of the injured worker by law. It is very important for the AME who is knowledgeable to be able to tell the difference. And generally, sometimes some doctors may not know that. The first issue at hand is the fact that the AME is knowledgeable, very knowledgeable. Why? They know they've been in this business for a long period of time. They wouldn't be selected as an AME if they were not known to both the insurance and the applicant side. So that's one issue that we can take off to the side. He's knowledgeable and he's accurate. Accurate is mandated even by law for anybody to do. If you're an AME, you know that this is mandated by law to be accurate. For a QME, it's mandated by law. But we have a lot of QMEs that don't even know that what really should be done in an AME. And by mistake or not, they may not be as accurate as desired, right? Because they're really not experienced in resolving disputes. And sometimes they may interject issues that may make the issue more complicated than resolved. Our job as AMEs is to resolve the dispute, stop the hemorrhage on the insurance, provide the applicant with compensation, return to work or not, and future medical as needed. So those are some of the salient points that needs to be understood about why AME instead of any way else for doing dispute resolution, medical legal report. The question to me right now is that, is the AME more expensive or is the QME evaluation more expensive? And the answer to that, there is an additional cost, 25% for the evaluation over what a QME charges. So AME, it charges 25% more for the evaluation only over the QME. But the review of records is the same. From that point of view, there is an increased cost getting an AME. Where does the AME save you money is by stopping the hemorrhage that we talked about and also not extending the case further and further and further. In general, AME is one report and it's done. And their word is final, and they usually don't come up with that reward unless they know what they're talking about. So they review the records or excerpts of the records, and they support that documentation. While if the patient himself or the injured worker did not get an AME to finalize his report, he may go on and on and on and on monthly payments. The DWC of the state of California at one time reviewed how much is the cost on patient care or injured workers care per month. The average is between $7,000 to $10,000 with or without surgery. If the settlement sometimes is $20,000, that's almost 2 months worth. And then there is no more hemorrhage. There's no more payment by the insurance company, and it resolves that part of the dispute. So that's why I feel that in general, when the AME finalizes the case, it does stop on the hemorrhage. And in general, it costs the insurance company a lot less money. Sometimes the insurance company themselves would rather see 2 reports. If they don't know an AME and they're not trusting of his report, they want to see more than 1 report. So they ask for a QME, and they take the QME report against a PTP, which is a primary treating physician's report, and they say, we want to go with that or with that, which is ever less expensive on them. But almost this is a crapshoot. It's never really the accurate way of looking at things. The most accurate way is being AME, or really, if you find a very experienced QME, it would be that. So in general, AME, although you pay 25% for the evaluation, which is less than $700 extra for the evaluation, but in general, it decreases the cost to the insurance company. As you probably already know, I have multiple locations. The main center is our Orthopedic Center in Huntington Beach, as well as Long Beach, as well as Riverside, and 2 locations, as well as Santa Ana and Anaheim. Please, if you have any questions or any AMEs and orthopedics that needs a resolution, please send them to our office at 714-841-5333. This is the central number that you can schedule at any of our multiple locations. Thank you again for listening to my podcast. Have a beautiful day. Dr. Paul Wakim. Thanks.